The first thing that you get from your parents is the values that they instill. So I really do understand their legacy more when people are talking to us about them.
My dad was thoughtful, warm, and he was a person who was always genuinely willing to give his heart.
And was always excited about delivering babies. It was not a chore to him. He found great joy in that. That's just who my dad was. I think my mother played a bit of a secondary role to my dad in that everybody knew who Dr. Pace was, but once they knew this was Mrs. Pace, then I think they equally gushed over her and would talk about the baby that Dad delivered.
She was always very proud of my dad's work. She was very much part of it. And he never forgot to remind people of that, or remind us of that Mom was there to support him in his practice, in his life, the life that they had chosen. And Mom did most of the care. We all skied. Many of us played a musical instrument or two or three. All the boys played football. And all of those things were Mom's coordination.
In the community, she was always willing to help, and often that went unseen. My mom worked to help other people around the community that were in need and gave whatever she had.
They met at St. Michael's Hospital, and it was just love that started very naturally, and they were good friends. They had a common interest in medicine and caring for people, and you could see my mom and dad were very, very close, good friends, very much in love, and it was a really amazing model to see as a child, to see that two people could, with all the hecticness of life that was going on with so many kids, they were still very much in love right until the time my dad passed away. I remember speaking to the chief of staff at the time, and she said, "Kate, there's so many doctors here in the room. There's so many nurses here to pay respects to your father." And she said, "What you don't realize is that there's cleaning staff here, there's cooking staff here, there's people in administration from the hospital here." And she said, "Your father valued each one of those people as a valuable member of the team." That's how my parents operated. They worked as a team. They knew how to work as a team within our home environment. They knew how to work as a team in a hospital setting with their colleagues. They knew how to work as a team in community. And that's just something that it continues on in our family. It's very important to us as a family that we stick together, that we're close, that we assist each other, we help each other. And it's been really evident in the past couple months since my mother's passing.
We didn't know she was as sick as she was at the very last day, and we were heading to be with her, and they were trying to facilitate an opportunity for us to be with her over the weekend. But that didn't get to happen because of COVID, and I know that that's been a struggle for lots of people. But I feel confident that she was cared for, even though we couldn't be with her.
She knew she was loved, and I had a great sense that there was nursing staff there was medical staff that walked her through that process, and that was very comforting for all of us.
I work in healthcare, probably largely because of my dad, but I really feel like it is an important place to bring communities together. Community cannot be healthy without a strong healthcare center, and that needs much more funding than our government can give us. So we need to have people who are passionate about giving back to their communities.
The hospital has been so supportive for not only my father, but my mother. And we know that there's so many staff members that we wanted to, in our own way, honor them back by saying, we recognize you, we thank you for all you've done for my mom, for my dad. And it just felt like the right thing to do.
This year represents our 10-year anniversary, and it's really a legacy of giving in this community. It goes back even before the build of the new hospital. This institution became a reality based on investments from you, our donor, and you've made care close to home with the highest level of innovation and technology possible. That in fact was incredibly flexible and useful throughout the pandemic. So thank you for keeping North Bay Regional Health Center in your hearts and continuing to make that investment to make us the best organization possible.
Since 1999, more than $3 million has been raised in memorial donations to help purchase advanced medical equipment to serve our community. When your loved one's memorial donations reaches the threshold of $2,000, their name is added to our Celebrating Life memorial wall. In this ever-changing environment of the pandemic, I know there is hope and optimism that we'll be together next year and celebrate all who appear on our Celebrating Life memorial wall. Thank you for your generosity.